Good day, everyone. Please note that this is being recorded and we will post this on our Region 7 Science page. So thanks to Region 7 for that. Also, thank you for joining today's webinar. It's titled Exploring Environmental Health Data Using an Interactive Data Visualization Application. This is the first webinar in a series of 2. Today we'll demo the tool, and next week we'd love to hear from you. So please contact me by the end of this week and we will set something up. Let us know how these data viz tools can help you. And if everyone can help us and just stay on mute, thank you so much for that. Do know that we have our cameras on, so we are going to all turn on our cameras so you can meet our team, but for bandwidth purposes, we will turn those off after our quick intro. So my name is Dr. Sala Nanyanzi Semkai. I'm currently the Quality Assurance Manager within the Office of the Administrator's Greenhouse Gas Reduction Fund. And I'm going to turn it over to Amanda.
Hello, everyone. My name is Amanda Berry, and I work in environmental justice at EPA Region 7. I will turn it over to Dr. Ronel Bridgemohan.
Hi, good afternoon, everyone. My name is Ronel Bridgemohan, and I'm in EJ at Region 6, and I'll now pass it on to Meredith. Thank you.
Hello, everyone. I'm Meredith Navis, and I'm a microbiologist at EPA Region 7 in the laboratory, and I'll pass it on to Dr. Alicia Dunn.
Hi, everyone. I'm Dr. Alicia Dunton. I'm a toxicologist and human health risk assessor at EPA Region 7, and I'll pass it on to Carlos Chabria.
Hi, everyone. My name is Carlos Chabria, and I'm an EJ and also a risk assessor at EPA Region 7. And now I'll pass it back to Sala.
Thanks so much, everyone. So just a quick outline for today's events. We are going to be looking at 2 visualization tools. The top is RED and the bottom is SAMI. We're going to start with SAMI. It helps with noting bacterial zones of concern or hotspots during flooding, hurricanes, as you can see from this video. So to better help us understand those relationships, we pulled that data and information into RED. RED originally had these features. I'm hovered over at the top. So just recently, just this year, it's been enhanced to include widgets. And maybe with your feedback, we can add more. So RED stands for the Regional Environmental Health Data Viz app. And SAMI stands for Source Assessment Mapping Interface. Next, we're going to show you some examples of other tools, other visualization tools. We're also going to discuss HIAs, health, data, do a quick demo, and end with a summary and a Q&A session. We have several important disclaimers within this webinar. This one states that these draft maps and analysis present an additional approach EPA is using to identify areas of potential high exposures or hotspots. The approach uses publicly available data together with new applications or geospatial and statistical methods and models that are being demoed outside the agencies, which speaks to our very evidence-based approach of presenting at venues like this, getting feedback, using that feedback to update the tools and repeating that cycle. Note, collaborating with other agencies and combining these data allows decision makers to appreciate connections between multi-dimensional data sets and provides we've used a very multidisciplinary approach of conversing with other countries like New Zealand and other agencies like CDC and NASA, because we really did not want to invent the wheel or reinvent the wheel. Here's a quick example of New Zealand and some of the work that they've done. The top shows you a map or an area and information surrounding it. The bottom shows you 2 maps and information about those, in addition to widgets like a scatter plot. And ours really does resemble the bottom one. Another examples from the World Health Organization or the WHO, they're looking at childhood mortality from 1990 to 2015 here. You can quickly see the areas that do not have an issue and the areas that do. I happen to be from East Africa, so I was very interested in those that are high for this. And so I went ahead and selected those. You can see over the years, that trend is a downward trend. So that's good to note because it is a very sad statistic. So in just a few minutes, we've learned more about this information. As you can see, these tools are just really powerful and they do put data at our fingertips. We do have several important goals. One is to develop a tool that's useful for our stakeholders. So if your feedback is something like red would be useful for you, then we would love to hear from you. The other goal is to incorporate the HIA or Health Impact Assessment Framework of screening, scoping, and assessment, and the use of RedViz to display community characteristics of health impacts and trends like PM 2.5 and asthma. I'm going to go to the bottom of this slide. Note that we did work with subject matter experts from CDC's National Environmental Public Health Tracking Network to pull in their health data. We also worked with our very own subject matter experts at EPA on pulling in environmental and socioeconomic information as well. We did this because we wanted to look at the cumulative impacts on health of stressors, things like environmental pollution, climate change, social determinants of health. They all have an impact on our health. So to do all of this, we had to have a lot of good data. And to talk to us today about data, I'm going to send it over to Amanda.
Thank you, Sala. The RED team placed an importance on maintaining common spatial layers for consistency in the data. U.S. Census geography can be displayed in a myriad of different geographical layers: the state level, the county level, a census tract, the smallest level that protects anonymity, a block group, or even at a central point within that block group. And in order to visualize comparisons between different types of data, for consistency, RED displays at the county level. The majority of the data that is pulled is already at that county level, but an additional process was used using counts and density to display other data points as well that have that consistency and importance of that common spatial layer at the county level. Next slide, please. And in addition to valuing this consistency of data and spatial layers, there was also an emphasis on using quality data and information. The tool displays a myriad of data from multiple high-quality sources, the first of which, as shown in the chart at the top left of the screen, from the CDC. To provide examples of the types of data pulled from CDC, there's health effect data such as asthma and cancer, population health data such as lifestyle risk factors, and environmental data such as outdoor air quality and housing conditions. All of this data is linked using an API connection, which means that it's consistently updating in the RED and the SAMI tools, that whenever CDC updates their data, it's updated in RED as well. These tools also pull from EJ-Screen, which is EPA's environmental justice screening and mapping tool, from data from our tribal partners, such as Cherokee Nation, who actually received an award in 2023 for their partnership on this project and work with lead and radon data. Then it also uses both state and regional data. And the importance of using quality information is that 24% of all deaths worldwide are attributable to modifiable environmental factors, as shown by the World Health Organization's 2016 global assessment. So the more that we can get our data right, the better that we can protect human health and the environment through visualizing that environmental health data. Next, I'll pass it to Dr. Ronel Bridgemohan, who will be providing a demo.
Hello, everyone, and thank you for joining us today. Before we dive in, I'd like to take a moment to recognize the invaluable work of Meredith. Her dedication in sourcing and integrating the dataset codes for this app has made it possible to bring in the essential water quality data that powers today's demonstration. So thank you, Meredith. Today, we're tackling a crucial global health issue, the impact of climate change variables, storm events, flooding, all on fecal bacteria contamination and water quality impairments on human health. This challenge is not just a global issue, it's a regional and local one, affecting communities across the US. Our RedViz app is designed to help visualize these environmental and health issues and risks and support regional visualization and response to improve water safety. According to the WHO, contaminated water is a leading cause of diseases like cholera and typhoid, contributing to over 500,000 diarrheal diseases and deaths each year. 500,000. Yes. In the US, like enterococci and E. coli, as microbial indicators of contamination that signal potential pathogen risks. RedViz aims to make this data accessible, especially for flood-prone areas and communities with potential EJ concerns. Next slide, please. As climate change intensifies, extreme weather events like floods are becoming more frequent and severe, compounding public health risks, especially in communities with potential EJ concerns. Understanding the direct impacts of flooding on health is critical, yet many systems fall short of capturing this full picture. Hence, RedViz steps in to bridge this gap by integrating various environmental health, water quality, and climate variables. This platform, RedViz, allows us to visualize environmental and health indicators alongside these climate and flood, which helps us to understand the spatiotemporal impacts of these fecal bacteria and water quality with these climate events. Heavy rainfall leads to more stormwater runoff, which often captures and carries fecal bacteria into water system. This runoff amplifies public health risks, especially in communities with potential EJ concerns, as we saw with Hurricane Harvey. Through RedViz, we're starting to comprehend these interactions in a spatiotemporal context. And this is an invaluable step for monitoring and mitigating risk in real time so that we can improve our SAMI app. Our goal is to fill a vital gap by studying the link between flooding, bacterial contamination, and health outcomes, particularly in communities with potential EJ concerns. Understanding via RED and your feedback will significantly aid us. With advanced visualization tools, we can better map and respond to health impacts of waterborne contaminants. Dr. Sala will now aid me in an exploration demo with our water quality variables that we've pulled in from SAMI into RED. Let's jump into the data. RedViz allows us to explore water quality variables across the US, filtering by state or zooming out for national view. We will start with a demo on selecting state-level data, but feel free to explore different scales as we go. We will focus on a 2020 data, looking at key water quality indicators like flooding and impaired waterways. These factors are central to understanding the health of our waterways, particularly in areas prone to contamination. Now we look at flooding versus impaired water bodies. Our first demo highlights areas where flooding overlaps with impaired water bodies. This view reveals hotspots where floods would worsen existing water quality issues, spotlighting where public health risks are highest. Now we would look at dissolved oxygen versus impaired water bodies. As Sala scrolls over to dissolve oxygen, we will now examine how DO levels and impaired water bodies look through the lens of red viz. As you know, DO is crucial for aquatic life. Low levels can lead to hypoxic conditions, thus threatening aquatic life. With red viz, we can sort the data table on the right by location from high to low or alphabetical order, as seen in this table. Thank you, Sala. Based on these DO levels, we can quickly identify areas under significant ecological stress, guiding targeted monitoring and restoration efforts. Now, we would look at DO versus stability. As this loads, we will now look at the correlation analysis that's on the bottom of the. And moving on, we'll look at this relationship between DO and turbidity, and the correlation analysis, as you see, illustrates this. By visualizing the correlation, we can pinpoint where managing turbidity could improve oxygen levels, supporting healthier ecosystems. Now we would look at DO versus turbidity. For a more localized perspective, let's zoom in on Florida, as Sal has done. Here's a scatter plot of DO versus turbidity, which reveals specific trends in Florida's unique aquatic ecosystem types, giving us insights into how turbidity impacts oxygen levels at this state level. This feature helps us to tailor interventions for areas with unique environmental challenges. RedViz, water and climate visualizations, and SAMI are powerful tools for understanding how various environmental and health, as well as climate variables with fecal bacteria interact, particularly in communities with potential EJ concerns. By layering water quality indicators with climate data, we gain a clearer picture and understanding of these challenges through visualizations that these communities face. Our ultimate aim is to use these platforms to inform better monitoring and management practices by empowering communities to address water quality issues more effectively. Thank you for joining us on this exploration today. Your feedback is essential as we continue developing RedViz and using this platform to improve SAMI tool to provide comprehensive regional environmental health and water quality insights. And now I will turn it over to Amanda to continue. Thank you.
The goal within these applications is to support where applicable with. The benefits can include helping to identify where data gaps may exist, to provide consistency of all being on the same page if we use the same data systems and the same data, of having that consistent approach, and can also help prioritize areas of interest, whether internal or external to EPA, by narrowing down the focus to areas that might be most overburdened for specific data points. These applications also can help know where communities might be experiencing a disproportionate share of the environmental burden, where areas might be more underserved, in order to help bolster tribal resilience and resilience in communities with potential environmental justice concerns. These tools include maps, trend lines, charts, and data tables to provide various ways to visualize data, and all of the data is downloadable. Throughout the process has been incorporating evidence-based approaches and incorporating feedback as well, because we want to make these new applications work for you. If you have comments or suggestions, please reach out to us as we welcome your feedback. And that leads us into our next portion of this webinar, which is where we're asking you of what you would like to see within visualization tools such as RED and SAMI. We have a quick survey. The link is being placed in the chat. Please let us know if the link isn't working for you by raising your hand or adding a comment in the chat. And we recognize that these tools are probably new for a lot of you today. And that's all right. What the survey is asking is, what would you like to see in the tools? It allows for multiple responses. So if you can't answer all of the questions today during this time, please submit what you can and you're welcome to revisit it later. The different point, we'll also have a follow-up webinar next week where it'll be expanding upon it as well. Next, Dr. Alicia Dutton will walk through each of the survey questions. We thank you in advance for any feedback that you can provide to help us better tailor this tool to your needs. Alicia, I think you're on mute.
I'm still not hearing Alicia. Carlos, are you there?
Yes, I can read it. So this is our Regional Environmental Health Data Visualization, or RED, Usability Testing Survey. So first of all, we want to thank you for attending this webinar about the RED tool. The below questions about user feedback will be used to inform updates to the RED tool. The survey is estimated to take no longer than 10 to 15 minutes to complete. So the first section is the organization and the user background. And question 1 is, please select the options that best describe your organization. We have community organization or nonprofit, local or state government, federal government, professional organization, college or university, or EPA grantee or other, and please specify. So question 2, within your organization, how much would you estimate visualization or mapping tools are used to aid decision-making for research or for other organization functions? Always, very frequently, occasionally, rarely, or never. Question 3, how often do you use environmental and/or environmental health data to make decisions for yourself and for your organization? Always, very frequently, occasionally, rarely, or never. So the next section covers the Regional Environmental Health Data, or the RED visualization tool feedback. So please answer the below questions based on the webinar demonstration of the RED tool or from your prior experience using the RED tool. So number 4, have you used the RED tool before this webinar? Yes, no, or other, and please specify. And number 5, if you have used the RED tool previously, in what context did you use the tool? And please specify in the box below. And number 6, please select the choice that best describes the ease of use of the RED tool. You have very easy to use, not easy or hard to use, and very hard to use. And then number 7, what could make the RED tool easier to use? And please specify in the box below. Then number 8, please select the choice that best describes how easy results, such as the maps and the variables, were to understand it within the red tool. We have very easy to understand, not easy or hard to understand, and very hard to understand. Then we have number 9, what could help your understanding of red data? Please specify in the box below. And then number 10, please select the choice that best describes how useful the red tool would be for you or your organization. We have very useful, sometimes useful, occasionally useful, a little useful information, or not useful. And number 11, what would make the red tool more useful for you or your organization? And please specify in the box below. Okay, and then we'll start section 12. So how do you anticipate red being used in your organization? Please respond yes to as many uses as they apply. So the first one is identify potential environmental issues in my community, neighborhood, or geographic area. And we have a yes, maybe, or no. And then the next one is increase my understanding of an environmental issue in my community, neighborhood, or geographic area. And we have yes, maybe, or no. The next is identify geographic areas where I may need to focus community outreach efforts. Yes, maybe, or no. And then we have highlight environmental burden between communities, neighborhoods, and geographic areas. Yes, maybe, or no. And then the next is highlight demographic characteristics between communities, neighborhoods, and geographic areas. Yes, maybe, and no. And then we have identified geographic areas where I may need to focus inspection or enforcement activities. Yes, maybe, or no. And then we have informed planning for my community outreach efforts in select geographic areas. Yes, maybe, or no. And then the next is identify land uses in geographic areas, communities, or neighborhoods. Yes, maybe, or no. And then we have estimate income and or race data for a community, neighborhood, or geographic area. Yes, maybe, and no. And next is identify potential environmental health impacts in communities, neighborhoods, and geographic areas. Yes, maybe, and no. And next is identify communities, neighborhoods, and geographic areas vulnerable to environmental hazards. Yes, maybe, and no. And we have classroom instruction K through 12. Yes, maybe, or no. And classroom instruction at the college level. Yes, maybe, and no. And then if there's anything else, please specify in the box provided below. Okay, number 13. Do you anticipate yourself or your organization using visualized information such as from RED to inform decisions related to questions of interest about a place or issue? Yes, maybe, and no. And question 14, what data would you like to see added to RED? And please provide the information in the box provided. And then number 15, what data do you think is not relevant to your community and recommend removing from RED? And please specify in the box provided. And then last question, number 16. Please share any additional comments or feedback about the RED tool. And please provide your information in the box provided. And please don't forget to press the done button right there below when you're finished with the survey. And thank you everyone for your feedback.
Thank you so much for that, Carlos, and everyone, Amanda, for going through that. We really do appreciate everyone's feedback, so thank you for doing that. If you would like to also just send us a quick email, here's our email address. We can also, I believe, copy and paste some of this and put it in the chat for folks. And if anyone wants to visit either of the tools, do know that we are working on getting information into SAMI, so it's relatively empty, but all of the water variables that we are looking to add have been added to RED, and so this is the QR code for RED. I will leave this up here and we can go ahead and get started with Q&A. So I can't see the chat, but Carlos,
Nothing in the chat.
Nothing in the chat. Thank you so much for that. Has anyone raised their hand?
No hands raised. But if you want to go back to the line with our contact information, people can always email us with any sort of feedback or any questions that they have.
Thank you for that, Carlos. And here that is. So this has been recorded and will be placed on our EPA Region 7's science webpage. So thanks to Region 7 for doing that for us. I will go ahead and stop recording.
We do have one question now. Someone is asking for the link to the RED tool. And we can certainly provide that in the chat.
We can provide that in the chat. Also, if you have a phone, there is the QR code. We could go back to that slide just really quickly here so folks can have access to it. So the red viz is going to be on the left. And we would really, really like to thank everyone for participating today. Get us your feedback so it'll immensely help us update this tool so that we can make it useful for you, the user. And we appreciate your doing so.